people are not aware about the impact of what they're doing in terms of driving a resistance. We have seen from reports and from studies that globally there are around 1.3 million deaths that are directly attributable to antimicrobial resistance. And Africa and Kenya is one of the countries that bears the biggest brand because of challenges of our health system. So if we do not put together measures to be able to address this menace as a country, we are going to suffer a big impact. In fact, our desire to provide universal health coverage and fulfill our sustainable development goals is going to be endangered because of AMR. So as NASIC, we have prioritized a number of activities during this World AMR Awareness Week, which usually runs in the month of November, to create awareness among different stakeholders in the One Health space. In mitigation, what is their role in terms of addressing the drivers and different interventions therein. Basically, the role of advocacy as well. So this is one of those activities that we are trying to promote. So health promotion really is a way in which we can be able to translate our AMR policies into action. And one of the ways we think that this is important is working together with to ensure there is action within the community. That is why the community health promoters and the health promotion officers serve as our frontline defenders, because you are the ones who interact with the households or almost on a daily basis. And we think that some of those messages that have been prioritized can be disseminated by this important segment of the community. And I'm sure the presenters who are here today will be able to talk about how you can be able to do this, how you can support this awareness action. And we are happy that we have collaboration from across the different sectors, starting all the way from the national level as NASIC, the National Antimicrobial Stewardship and Agency Committee, which comprises of colleagues and representatives from the animal health, from the human health, from environment, from plant health, from aquaculture. We collaborate and work together to be able to build bridges to ensure that we address issues on infection prevention, appropriate use, awareness creation, surveillance, and so forth, so that we address drivers across the different sectors. So mine is to just reiterate that this year's World AMR Awareness Week, our theme is for us to act now so that we can be able to protect our present and also secure our future. And one of the things is we ensure that whatever we are going to learn from this webinar, we use it now. Let us not keep the information for future use. It is important that we translate that information to current action in our different areas. As I finalize, once again, I want to appreciate the Division of Health Promotion, the Division of Community Health, the National Public Health Institute, and then all the organizers for this important webinar. Thank you very much, and hoping that we are going to have a very fruitful webinar. Thank you.
Thank you very much, Dr. Tanui. As Dr. Tanui has mentioned, we also have collaboration with the Division of Community Health, and I wish to welcome Gladys. I wish to welcome Gladys Mugambi, Head of Division of Health Promotion and Education. Gladys, are you in?
Yeah, good morning, everyone, and thank you very much for Sorry. Sorry. Can you hear me?
Yes, we can hear you. Go on.
Yeah. So I want to say thank you, everyone, for attending this important meeting that is supposed to help us understand how we can all participate in creating awareness concerning AMR. Thank you for the organizing team for putting all this together. Our key role in health promotion is to create awareness, to build capacity for people to be able to talk about AMR, and also generally create awareness on health. And today, Frank is going to give us more details on this. So my role is basically to applaud the team, because the only way we can change things around is by working as a team, working as several sectors, so that we can be able to bring on board various stakeholders and experts to communicate. We only have one challenge, that sometimes we experts do not talk. We experts do not, use the latest technologies. And I think some of the things we need to learn is how this can be done, and also making sure people are involved in this awareness creation. So this is to welcome everyone, and I know through what Frank will be presenting, we'll be able to get more details on what we need to do. So welcome everyone, and thank you very much.
Thank you very much, Gladys, from Health Promotion. We also have a head of division for community health, Dr. Maureen Kimani. I wish to welcome you to give your opening remarks. Dr. Maureen? Any representative from the Division of Community Health? Okay. If not, good morning.
You can hear me?
Yes, we can hear you.
Okay, this is Judy Chapmanit, working for the Ministry of Health and the Division of Community Health. What morning for joining the meeting, and also applauding that community health is the backbone of health.
Sorry, Judith, you're breaking. I don't know if it's network. Am I audible? I don't know if I'm the one who's not audible.
Yeah,
we
Begi,
can
you're
hear
audible.
you.
Okay, then I'll request kindly, we do have the Division for Community Health having the closing remarks, so that you can go to the presentations. Then at the end, once we have them ready, then we can have them giving us closing remarks, since this is their one of their key partners in this webinar. Thank you. At this juncture, I'll invite Jennifer. Jennifer, kindly, I'm dropping my screen so that you can share your PowerPoint. Then you can start your presentation. Thank you very much. Jennifer, you can put it on presentation mode. Okay, perfect.
Thank you, Gere. I hope I'm audible for the preamble and introducing our SMEs. Yeah, today I want to welcome everyone to this session that we are working together on the role of health promotion and community health in combating AMR. As we know, health promotion and community health is essential in translating national AMR policies into actionable community health. And we are proud to have you here. As our opening remarks have stated, is that the theme of this year is Act Now, Protect Our Present, Secure Our Future. Now, by the end of this session, you should be able to define commonly used terms in AMR, that is antimicrobial resistance, describe impact of AMR, describe the causes and mechanisms of AMR, and then describe the drivers of AMR, and the mechanisms of the spread of AMR between animals, human, and the environment. We are also able to explain the significance of the One Health approach in the fight against AMR, and outline your role in community education, surveillance, and promoting rational use, and apply the key messages to combat AMR in the community. Now, what are the common terms in AMR? When it comes to AMR, you have to understand that we have microbes, or other names is microorganisms, which is a diverse group of microscopic living organisms that are too small to be seen with the naked eye, that include bacteria, viruses, protozoa, fungi, and algae. Some microbes or microorganisms are useful while others cause disease. Those which cause disease are said to be pathogenic. Now, how about antimicrobials? These are agents that inhibit or stop the growth of the microorganisms. They include the antibacterials, most commonly used, antifungals, antiviral, and antiparasitic agents. Now, what is AST? Many a times you're sent to the laboratory to do a culture and sensitivity, and there follows an antibiotic susceptibility testing. This is a method used to determine the sensitivity or resistance of a microorganism to a specific antimicrobial agent. So this is a test that comes out from the laboratory, and it shows whether the microorganisms you're carrying is either resistant to the drug you're taking or sensitive to it. So what is AMR? AMR is the ability of a microorganism to resist the effect of an antimicrobial or the drug agent that you've taken that once effectively worked against it. Now, what is One Health? This is an integrated, unifying approach aiming to sustainably balance and optimize the health of people, animal, and ecosystems. So there is an interconnection. One Health approach encompasses three main sectors, that is human health, agriculture, that is animal health, and crop development and environment. One Health promotes multi-sectoral collaboration, communication, and coordination to address challenges like AMR, zoonotic diseases, and environmental health. And as you can see from this diagram, there's a connection. So what is antimicrobial stewardship? And I want to applaud you for joining this session, because automatically you're going to become a steward. So this is a coordinated program that promotes the appropriate use of antimicrobials to improve patient outcome, reduce AMR, and limit the spread of drug-resistant organisms. What is a diagnostic stewardship? A series of coordinated guidance and interventions to improve appropriate use of microbiological diagnostics to guide therapeutic decisions. Now, the antimicrobial stewardship and the diagnostic stewardship work together so that we compact AMR together wherever we work. So which are these drivers of AMR? Drivers of AMR are factors that contribute to the development, spread, and persistence of AMR. So as it has been said, alluded before by the speakers, what is the impact? According to a 2022 study, it shows from here that we have had 1.27 million deaths from 2019, and 4.9 million deaths were antimicrobial resistance spread alone. An estimated 4.95 million deaths were associated with AMR. Of these, 1.27 million deaths were directly attributed to AMR. Africa carries over 20% of the global burden of disease. Drug-resistant infections are associated with over 1 million deaths and directly cause about 250 deaths annually in sub-Saharan Africa. Now, in Kenya, there were an estimated 5,280 to 8,060 deaths attributed to AMR and 23,800 and 33,300 deaths associated with AMR in 2021. This is really alarming data. If not effectively addressed, then AMR is expected to result in a 3.8% decline in the global annual gross domestic product, equivalent to a global economic loss of about USD 100 trillion by 2050. Therefore, we have a mandate to reduce this. Why is AMR a global concern? It threatens treatment of common infections, resulting in increased mortality and morbidity. It heightens the risk of complications and adverse outcomes associated with medical interventions like organ transplant, dialysis, cancer chemotherapy, major surgical procedures, among others. It leads to increased cost of healthcare with prolonged hospital stays and likelihood of critical care requirements. It puts the gain of the MDGs at risk, jeopardizing the attainment of UHC and endangers achievement of the SDG goals. It could impact food and feed production, trade and livelihoods, and increase poverty, inequity, and gender-based violence. Yeah, like if you have a patient admitted in hospital and the bill is high, you keep asking for money and maybe the husband now has lost income, of course, it will lead to gender-based violence. Now, we need to understand this classification of antimicrobials. So we have the antimicrobial class, the use, and some of the examples there. So we have antibiotics, and their use is to treat bacterial infections like bacterial pneumonia, mastitis, among others. And as you can see there, those are some of the examples. How about antivirals? Antivirals treat viral infections like HIV, canine parvovirus, and those are the examples. Antifungals, they treat fungal infections like candidiasis, ringworms, among others, and those are the examples. Antiparasitics, they treat parasite infections like malaria, worms, and among others, and those are the examples. So if we misuse all these drugs, we are going to get antimicrobial resistance. So how do this, like for example, this is a bacteria cell, how does it resist? So mechanism of resistance, there are many ways that a bacteria can, and you can see how a bacteria can be wise. So these are some of the ways that they resist. One of the ways is use of the efflux pump. They pump out the drug once it is administered, or once they get there, they reduce. There's reduction of permeability to the microbes, or they form a biofilm. That is some colonization there, and then the bacteria is not able to, the antimicrobial is not able to get into the cell, or the cell wall hardens. We have an inactivation of antimicrobials in here, or there's modification of drug binding sites. Sometimes we may have even mutation happening and the transfer of genes to the microbials. How does AMR occur? AMR occurs as part of a natural process whereby microorganisms evolve and adapt, then become resistant to antimicrobial agents. It can be slowed but not stopped. So from this diagram, you can see what happens. Number one, lots of germs or microorganisms. A few are drug resistant. There, the red ones. So antibiotics, once you take antibiotics, antibiotics will kill bacteria causing the illness, as well as the good bacteria protecting the body from infection. So what happens? The drug-resistant bacteria are now allowed to grow and take over. Now they become the dominating and they start growing and mutating. Some of the bacteria give their drug resistance to other bacteria, causing more problem. So what happens if you interact with a patient, if it's a respiratory infection, or a surface is contaminated with an AMR bag, you are likely to transfer the same. Like if you interact with an MDR patient, you get the MDR TB. If it's a TB patient, if it's a condition of caused by a bacteria that is MDR, so you still get the same. That is how it is transferred. So what are the drivers? We need to understand what drives AMR for us to combat it. And the drivers are factors that contribute to the development, spread, and persistence of AMR. These drivers accelerate the evolution of resistant strains, reducing the effectiveness of the treatment and leading to harder to treat infections. So these are the drivers. We have the category and the drivers cutting across human, animal, and environmental sector. So number one, inappropriate antimicrobial use. And this is common. Overprescription and misuse in human and animal. Use without diagnostics. That is empirical treatment. You just take a drug without knowing what you're suffering from. There's no rationale on why you're using that drug. Mass drug administration. If you have like animals which are sick, one animal gets sick and then you give all the animals, or you hear there's an outbreak somewhere, instead of treating the few people or isolating the few people who are sick, you decide to give drugs to the whole community. That one is another inappropriate use. There is use as growth promoters and prophylaxis in livestock, whereby you want to get more yield because of prevention of infections, so you give antibiotics. Self-medication and informal access to antibiotics. You decide to go and treat yourself because you feel you're sick. You prescribe on yourself and you buy medicines, and you are able to access them apparently over the counter. Incorrect dosing and incomplete treatment. You feel better and you feel you can stop taking the medication. Now we go to the poor IPC, infection prevention and control. We have weak IPC in hospitals and farms. IPC guidelines are available in hospitals, but sometimes adherence is low, whereby hand hygiene is not complied to, and bags are transferred from one patient to another from surfaces. So many of these things affect the patients and the community in the hospitals. How about the farms? Farm hygiene is very important to prevent infection. Low vaccination uptake in human and animals. Vaccination supersedes taking drugs, and so vaccination is key. Low hygiene, sanitation, and waste management practices. So it's important that we understand the IPC guidelines and be able to apply in all sectors. How about diagnostic and surveillance gaps? We have limited capacity and delayed diagnosis. Yes, we have laboratories, but many of them do not have capacity to perform culture and sensitivity. And those, even those which are performing, there is low utilization, whereby clinicians sometimes will treat empirically, or may not even use the laboratory results. So it is important that our prescribers use the laboratory results. And even when it comes to animal, if an animal is sick, do not treat, but just send the sample to the laboratory for testing so that you treat for the right infection. Weak AMR surveillance across sectors. Yes, if we are not able to monitor what kind of resistance we are having in the communities, we are not able to know what kind of bugs we are working with. So surveillance is good to watch and monitor and get to know what is this that is affecting our areas. Lack of integration between human, veterinary, and environmental data. We need to work together so that we see which are these drugs that are cutting across all areas. A drug which is in a bug that is infecting human may infect an animal, may go to the environment and cause many havocs in many other sectors. Quality of medicine. Sometimes we have substandard and falsified drugs in human and veterinary sectors. How about environmental contamination? Here is where we get improper disposal of hospital. Whenever we have very good waste management in our facilities, but however, do we know where the end product is taken? It is our mandate to know whether what we have actually collected from the hospital is being disposed well to not affect the environment, the community, and pharmaceutical waste as well. Agriculture runoff, that is antimicrobials, runoff through the waters, manure and fertilizers, industrial pollution in soil and water, and this is all about contamination of environmental. So let's be cognizant on how we are managing the waste. Movement and globalization, human travel and migration. This is an area that also has caused transfer of AMR from one place to another. So we have to be cognizant that we have to be our next neighbors, brothers keepers, and make sure that we comply with the international laws to avoid transferring these infections to other places. Trade in animals, food and agricultural product. Make sure that our products are inspected to ensure that the products coming in are safe for human consumption. Spread of resistant organisms across borders happens. Then how about knowledge and awareness gaps? CAP surveys have shown that we have limited education among prescribers, farmers, and the public as well. Low awareness of AMR risks in communities and food systems. Go to the market and see how people are preparing food, and you'll see that the public really has low awareness of this. How about policy and governance challenges? We have weak regulatory frameworks for antibiotic use and sales. Yes, we have the laws, but we have the regulatory framework. That enforcement is really weak. How about limited enforcement of these existing policies? How do we go about this so that we enforce and people comply? Inadequate financing for AMR, yes, but we have low-lying fruits. There are things that we can do. IPC is one of the low-lying fruit. Some of these guidelines are really easy to implement. So even with limited finance, we can still combat AMR in our areas of jurisdiction. How about socioeconomic and cultural factors? Poverty and limited access to healthcare and veterinary care. Yes, but again, even with poverty, we can still do our best to maintain hygiene. Cultural practices that drive misuse and of antimicrobials, whereby people feel that they can share medication with themselves or with the animals. Pressure on prescribers to meet patient and farmers' demand. Let's be ethical prescribers. Let's not follow the demands of patients and farmers, but do the right thing. Now, this diagram shows all what I've talked about, and you can see all this contribute to AMR, and more so excessive use of antimicrobial animals. So I will not belabor going through the diagram. You will see after I share the presentation. So how AMR spreads? AMR can be transmitted through multiple pathways, including person-to-person transmission. That is, as I said, resistant microbe can spread through direct contact, poor hygiene or contaminated surfaces, food and water contamination from livestock and crops treated with antimicrobials can enter the blood chain and water sources. Environmental spread, waste from hospitals, farm homesteads, and pharmaceutical factories can introduce resistant microbes into soil and waterways. And then globalization, that is movement of people and trade in agricultural produce across borders, can carry and spread resistant microbes worldwide. So this is a diagram describing how the antimicrobials can create resistance. This man here is called George. George gets sick, and George can stay either at home or go to the hospital. George gets care at hospital, and then bacteria can spread from in the hospital. The resistant germs spread direct to other patients or indirectly to unclean hands of the healthcare workers. As we said, IPC is important. And then the patients will go home and spread the infection to the community. Again, the animals can get antibiotics and develop resistant bacteria in their guts. These animals, these antimicrobials can get through into the environment from the manure. So this is a demonstration of how resistance travels along the ecosystem. So you'll go through it once you get the presentation. So what is the significance of One Health? Since resistant pathogens can spread between human, animal, crop, and the environment, a collaborative multisectoral strategy is essential for effective AMR mitigation. Interventions to prevent, detect, and respond to AMR must be multifaceted and involve collaboration across human, animal, crop, and environmental health sectors to achieve sustainable and long-lasting results. By adapting a One Health approach, countries and counties can take a more holistic and systemic course of action to control AMR. Since resistant pathogens can spread, One Health integration of efforts across sectors ensures enhanced AMR surveillance and early detection, that is, integrates AMR monitoring across human, animal, crop, and environmental sectors, detects and tracks resistant pathogens before they spread widely, promote prudent antimicrobial use, that is, encourages responsible antimicrobial use in human, veterinary practice, and agriculture to prevent misuse and overuse, reduces the selection pressure that drives the emergence of resistant microbes, and then prevents cross-sectoral transmission, that is, recognizes that resistant microbes can spread between animals, humans, crops, and the environment. It implements measures to control transmissions through food, water, and direct contact. So for key messages on this, AMR is the ability of microorganisms to stop the agent from working against it. AMR causes significant morbidity and mortality, and you could see from the numbers. One of the major causes of AMR is the inappropriate use of antimicrobials. One Health is an integrated multisectoral approach in the fight against AMR. So we have a shared mission to fight against AMR. This involves translating national AMR policies, and we have many of these policies with us, into actionable community practice that saves life. We achieve this through a coordinated system where strategy and coordination at the county level meets action, education at the household level to explain AMR in simple language, promote correct antibiotic use, dispel myths and about antibiotics and antimicrobials. So I thank you so much for listening, and at this point I want to welcome my counter presenter, that is Francis Mutia from the Health Promotion. Thank you.
Thank you very much, Jennifer. And allow me, please, I request you just to continue the presentation. Thank you very much. So, colleagues and everyone, good morning. My name is Francis Mutia from the Division of Health Promotion and Education Management within the Ministry of Health.
Welcome.
And I'm happy today to collaborate with you to provide information about how we can collaborate together in terms of managing antimicrobial resistance. So at this particular point, we are going to look on how we can work together, and we can see because we are working as a team to help our community, the health promotion officers and also county health promotion officers at various counties, we can work together to protect our communities from the health threats like antimicrobial resistance. So health promotion officers provide items like training and materials to the community health officers, and they hence take the message or the right message straight to the household level. And once the communities get this information, they are able to respond, and we are able to analyze the data to spot trends and make smart decisions. We are also having a role to coordinate with other sectors, especially where human, animal, and environmental health overlap. And because we are all healthcare workers, we are trusted faces at the ground, and we help manage all the grassroots health activities and build trust and real connections to provide health information. And then because this partnership, it will help us inform a powerful network. So we have actions areas that we are supposed to consider. Move to the next slide, please. Yeah, our first key action is on community education and awareness about antimicrobial resistance. In simple terms, we have seen from what Jennifer has presented that AMR happens when germs learn to fight the medicine. And this means the medicine stop working, and that is very dangerous. So we focus on our key groups, which include parents and families, and we are supposed to encourage them to finish prescriptions and never share antibiotics. The other category is farmers who interact with farm products, and we are supposed to show the risk of misusing antibiotics in animals and what we are supposed to do. Another key area is on schools, teaching our children about hygiene and powerful or the importance of getting vaccinated. And this is about protecting our present and securing our future. And the more people understand antimicrobial resistance, the stronger our communities become. Next slide, please. Our second key action is all about stopping infections before they start, because every infection we prevent means one less antibiotic we need to use. And that's how we fight the resistance. It is called the IPC, Infection Prevention and Control. So we use an IPC toolkit with simple steps and hygiene, showing people how to wash hands properly. Then safe water and food, encouraging boiling drinking water or treating our water, then handling food safely. On vaccination, of course, we are promoting timely immunization to protect against diseases. In terms of environmental sanitation, we push to proper waste disposal to keep our surroundings clean. So these are our everyday actions with life-saving impact. And when communities take charge of prevention, we protect everyone. So remember, preventing an infection means one less antibiotic that needs to be used. Our third key action is AMR surveillance. This means keeping watch for warning signs that the resistance or that might be spreading in our communities. And we have some items that we should look to. One is about treatment failure, when people say medicine are not working. Unusual sickness, clusters of severe, prolonged, or a similar illness that doesn't respond to normal treatment. Then risk practices like buying antibiotics without a prescription or using leftovers. If you spot any of these things, you should report immediately through the network or the system that is laid up allowed to ensure that we respond effectively. Remember, you are our eyes and ears of the system at the ground, and your alert can trigger a faster, stronger response and protect our whole community. Our fourth, or after now identifying our key actions, next is surveillance, or from surveillance to action. So once we spot a possible AMR risk, like treatment failure or risk antibiotic use, we don't just observe, we are supposed to act. And so we have some steps that we should do. One is leading community dialogues, bringing together local leaders, school, religious leaders, farmers, everyone to talk about what is happening. Then again, use the real data to show urgency, make the issue feel close and serious. Then again, reinforce the key messages. Prevent infection, use medicine correctly, and avoid self-treatment. Then step number 2, ensure rational use and referral, where you encourage people to seek care from trained health workers, not just a guess or a self-medication. If someone gets sick or antibiotics that were given are not working, you should refer them to the nearest health facility for proper testing. Then remember, we do not diagnose or prescribe. Our task or our mandate is to guide and connect. This is how surveillance is turned from just observing into action. And that's how it leads to communities protecting themselves and each other. Then our next action is on monitoring and reporting linkages. So this is about keeping the system strong through monitoring, reporting, and building strong linkages. And we are able to report the AMR-related issues, like what we have seen in our previous slide about the medicine misuse, treatment failure, and using the right channel to report any issue. Then give feedback and work closely with other teams, including the sub-county health promotion officers, community health assistance officers, and also the local health facilities. Keep record of community concerns, of what the community is saying and what actions they have taken. Then do a follow-up on reported cases to make sure they are addressed. So in this way, we create a very powerful cycle that is report, analyze, act, then feedback. That's how we make our response effective and based on the real data. It is not just about reporting, it is about connecting the dots and protecting our communities. So, next slide. Now, One Health approach in action. This is how we fight AMR using the One Health approach, because resistance doesn't just affect people, it is spread between human, animals, and the environment. So we work together across sectors, and with the veterinary officers, we report misuse of antibiotics in animals. With the agriculture, we promote clean, healthy farming to prevent infections. And also with the environmental officers, we speak out against dumping pharmaceutical waste, because we must protect the power of medicine for everyone, everywhere. Then we have key messages to drive the real change in how we use antibiotics and prevent infections. Of course, you are supposed to finish your antibiotics exactly as prescribed by the qualified health practitioner. Don't stop halfway, even if you have healed before your dose is complete. Never buy or use leftovers antibiotics. They may be wrong for your illness. So somebody should be tested so that you'll be given the right medication. Wash your hands regularly and maintain good hygiene. It is your first line of defense. Again, vaccination to prevent infections. Always seek advice from qualified healthcare providers. Then avoid misuse of antibiotics in animals. And that's how we can work together to keep antibiotics effective for our future generation. So lastly, we have our reference materials that can guide our work in fighting AMR, from national plans to the global toolkits. And this will be available after we share all this presentation. Then as I conclude, we have seen that the fight against antimicrobial resistance is not just a technical issue. It is a community mission, from education and infection prevention to surveillance and cross-sector collaboration. So every action we take, it is very important. Whether you are a health promotion officer, community health promoter, chair, farmer, teacher, or representing any group in your community, you are part of the solution. And we can protect the power of antibiotics and secure our healthier future for all. So I urge you to act now, and thank you very much. Now I hand it over to the moderator.
Thank you so much, Frank. Thank you so much, our presenters. Quite informative presentations. And I can say we have really learned. And I welcome all of us now to the Q&A session. Okay, yes, Judith, you can go on. Unmute.
Okay, thank you. All right. Thank you so much, Felista. Thank you so much to the speakers. I think the presentation was quite informative. My name is Judy Asin, and I work for EPN, where I spearhead all our AMR interventions within Kenya and beyond, working with the faith-based sector. So I have a question for Francis. I think that was really nice, and we've come to agree that the community is very, very key and critical. And even in the spirit of achieving UHC, we need to really build the foundation and strengthen the PHC level. So that's why I really, really like this session. And I wanted to ask, especially with the dialogues that you're doing, how are you able to measure impact of the dialogues? And maybe you can share any strategies that you're using. We've seen that this is a bit of a gap. Once we've raised awareness at the community level, what beyond that, how can we really present the impact of what we are doing? And I think the other one is just a statement to encourage the fact that AMR, especially in the stewardship aspect and in the facilities, many a times is really concentrated on the hospitals, but let us not forget the lower level facilities, the health centers, where antimicrobials are also used at that level. And so in the spirit of us interacting with our other health professionals, let us still continue spreading awareness on AMR at those lower level facilities and see how also to strengthen those facilities. So yeah, that's my question back to Francis. How do you measure impact following the community dialogues that you do? Thank you.
Thank you very much, Judith, for that question. Yeah, measuring the impact of community dialogues. Of course, this being one of the strategy to engage our communities to act, and being led by the county health promotion officers, collaborating with other officers within the health sector, we are able to see if the community members are able to act based on what they have discussed and agreed to follow, or the action that they have provided during the dialogue. And of course, when we see people using antibiotics correctly and also accessing health services at the qualified health practitioner, this is how we can measure the impact. Again, seeing the disease burden being lowered, of course, we are able to know, yes, our dialogue was successful. Again, when you are working in any intervention at the community, And then you engage this team. Of course, you are able to effectively disseminate any intervention that you are coming up with, and you are able to agree even on laying out indicators to know that our intervention is working properly. So yeah, and maybe again requesting Felista or Jennifer, if there's any addition, you can please add. Thank you.
Yeah, thank you so much, Frank, and thank you, Judy, even for that question. And I think it's a very key area, and it's something that we can actually think about, because when you go and talk to our people, like in the community dialogue on ways of combating AMR, or even giving them health talks on not misusing antimicrobials, or not like buying over the counter, how are we going to tell that they are no longer doing that? I think that is an area we tell, yes, after we did this community dialogue, now we can tell that the number of people who are going over the counter to buy antimicrobials have gone down. It's an area we can look at. Thank you so much for that very important question. Yes, thank you. Teresia, you can go on.
Thank you so much for the good presentations. It was quite informative, and we really appreciate. My name is Teresia. Mine is just an input. I know, of course, you are going to share the slides, and I really like the way today it was organized, because like sometimes you hear people talking about AMR, whereas if at all we have to succeed, we have to start at the grassroots. That is because these antibiotics are used at the household level, they are in the communities, and for a long time, I think it has been forgotten. But for the people who organized this meeting, that was great. And what maybe I wanted to bring to attention from experience of other programs, the way this has been started, I know it's going to work. And for us to succeed, yes, I know we have the two presenters, but also in future, also let us consider all our components. I know, of course, the Division of Community Health was involved. When we are inviting, let us not see that this complements. And I'm saying this because of the question that has been asked. We normally conduct the community dialogue. I work at the community level. We normally have dialogue. And now when we come and we are deliberating with the communities, the issues that come, we normally now plan to have, like they have said, these are the issues in our community. From the community dialogue, we normally have now the action days. What are we going to do as far as these issues have been raised? Because 1, 2, 3 has been realized. We have realized maybe the farmers are using a lot of antibiotics to animal. What are we going to do? Now from the action days, that is where now we plan. We'll be able to meet these people, we'll be able to do 1, 2, 3. So community will be very, very key, because after the dialogue, we'll have the action days. And of course, now from there, as we do the community scorecards, because in the scorecards there are so many things that will be able to come, we'll be able now to address, and where we have issues, if at all we know it's agriculture, it's whatever, we are able to action them, and at the community level we are able to follow. So thank you so much. We need to have the health promotion, the community, and also now the other components for us to win this battle, and we want to assure you of our support, and we also want to request that the slide be shared. Thank you.
Wow, thank you so much, Teresia. Thank you so much. In fact, you are so quite important. Health promotion and community health are the heart of prevention. And we so much appreciate that we cannot prevent or combat AMR when we don't have health promotion and community health on board, because the first thing is that we want even to prevent the infections before even we start combat. It's the number one thing of combating AMR, and we know how you empower the community, and they do the informed decisions, and they also adopt the health behavior, and actually even responsible use of antimicrobials. So quite key, and thank you so much for that. Any other questions for our presenters?
Thank you, Feli.
Feli, you can look at the chat.
the chat, and you hand over to Dr. Tanui and the heads to address some of the questions on the chat. Thank you.
Okay, thank you. Let me look at the chat. Is there IC materials to support dissemination? Yes, we have that. I'm sure, Gary, you're going to set the link. Do we have IC? Yes. Where should one health be domiciled? Which mechanism will be used to share alerts for real-time reporting? Public health space cannot be avoided in AMR surveillance. Embrace real multi-departmental collaboration in order to win for all. Maybe Dr. Tanui, you can try and address this, and especially where should One Health be domiciled? You can talk about maybe explain how we are doing it at the national level.
Yeah, thank you so much. First of all, to the presenters for taking as well elaborately, especially on the role each of us can be able to play and how AMR comes about. I think that has been a very informative session. Yeah, even the comments from the other participants, I think they have been very constructive, especially on how we can be able to do community dialogue, how we can be able to measure the impact, the scorecards, and even the role of CAPS and the knowledge, attitude, and practice changes at the community. If you can be able to do some form of CAP surveys to be able to assess whether there has been any knowledge disseminated or changes in practice, I think that would be good. So coming to the question on One Health, for me, I think One Health is something that we all do, especially in the AMR space, food safety space, zoonosis, climate change. So each of us are responsible for implementing these activities relating around One Health. So I may not be able to provide a clear answer on whom we actually want to be able to coordinate then the concept of One Health. But I think from our perspective of AMR, we work together with the different ministries and programs to be able to address AMR. And in fact, we are now happy that we have the Kenya National Public Health Institute that is spearheading a multi-sectorial a platform for us to work together from the different agencies or departments dealing with the One Health issues, so that we work together from one platform. I think that's a very good initiative, and for us to be able to collaborate more efficiently. The other question was on sorry, let me check.
Which mechanism will be used to share alerts for real-time reporting?
Oh, yes. So there's also an initiative by the KNPHI to have an integrated surveillance network, such that we have disease surveillance, zoonosis, AMR, food safety, and all those being on an integrated system, such that we can have an alert or signal from the lowest level being shared across the platforms. But for now, I think what has been happening is that from disease surveillance, they already have systems, even at the sub-county level, that can be able to share alerts. For us, in terms of AMR, multi-drug resistant infections, I think those are usually handled even at the facility level, so that if you detect a patient who has an MDRO, very quickly there are systems that are put in place, whether you want to isolate the patient, you want to put in place contact precautions or whatever precautions that are necessary, that can be able to be done. And then, of course, now share the share the report to the national level for action. Yeah, I think those are just in brief my remarks on those. Thank you, and back to you, Felista.
Thank you so much, Tanui, and thank you for that elaboration. And I hope, Benedict Muma, you have understood how we are doing it and how the future will gonna look like. Yeah, thank you so much, Dr. Tanui. Luis Kifadi, kindly, let's have your question.
Yes, thank you. Mine is not a question. I just wanted to say that for the pharmacists who are in this webinar, the event is CPD accredited. So they need to go to the PPB portal to subscribe. And then I'll give my number in the chat below so that you can send me your name and PPB registration number so that we can forward them to PSK for the CPDs. Thank you so much.
Thank you, Dr. It's quite an encouragement.
Maybe in addition, I don't know whether we are able to extract the attendance from the registration, so that even as we contact PSK and PPB for the CPD points, you can be able to use the attendance for confirmation. Thank you.
Yeah, sure. I think I'll contact Jennifer for the attendance register. Thank you very much.
Thank you so much. There is another question here, Dr. Tanui, and also even this one, I think even our AMR focal points who are here can help answer. What gap exists in implementing National Action Plan on AMR at sub-county level? And how can sub-county health promotion officers support clinicians in combating AMR stewardship initiatives, provide targeted messages for dissemination during these dialogues? What challenges do we have? What gaps do we have at this sub-county level?
Maybe I can go fast.
You can go fast.
Yeah. So because of the challenge of funding and financing, we have not been able to directly penetrate to the sub-county level, especially in terms of AMR governance structures. We have governance structures at the county level, what we call the CASICs. I know they work with the sub-county teams in terms of supporting work, but of course our vision would be if you can be able to have even a sub-county AMR committee to support work there. Most of the time, our AMR surveillance sentinel sites are at the county referral hospital. Our intention is to have our surveillance sites, including the sub-county and even the community surveillance, so that we get AMR information that is as representative as possible all the way to the community level. I know there are a lot of awareness activities that are being conducted at the lower level, which is really commendable. But in terms of surveillance, coordination, and such, I think those are some of the gaps. We are hoping that with the collaboration with the community health promotion and the community health structures, we can be able to reach out, to reach to the sub-county level in terms of awareness, because I think that requires very little financial support if this can be driven by the frontline workers at the lowest level who can do this with minimal support. But we have tried to look for support to be able to support dissemination of some of these modules at the sub-county level. And if we are able to succeed from next year, we should be able to work together in terms of supporting sensitization of CHPs and the health promotion officers at the county and sub-county level, and even support them to disseminate this information downwards. Thank you. And over to you, moderator.
Yeah, thank you so much, Dr. Tanui, for that. Yeah, and for Hafsa Osman, maybe we don't know which county you're coming from, but if you would like to know, we have several AMR focal points at the county level, and you can work together with them, and they can also tell you the gaps they're having and how you can work together to combat AMR at your county level. Thank you so much. Let's look for others. Checking, I think. Kindly share the slides. Yes, we are going to share the slides. Dege, can you see any other question, kindly? I don't
think there's any other question, but I'd like to clarify that the slides are on the link that I've shared on the chat. So you can download the materials plus the slides on the link.
Oh. Okay, yes, as we emphasize on the sensitization of proper use of antibiotics and One Health approach, where does the diagnostic approach come in? Remember, you can only address a problem properly if the diagnosis is done properly. Very true. Dr. Tanui, kindly, can you respond to that? On diagnostic stewardship.
Yeah, thank you, Festus. I think this is this is a very clear comment in that for us to be able to detect AMR, the diagnostic component is very, very critical because a lot of times we see practices where people prescribe empirically. I know of course, there's a very important role of empiric prescribing, especially when you require urgent intervention, but this needs to be supported with laboratory tests for confirmation. And for you to be able to confirm that this is actually AMR, you need to do the identification culture and susceptibility testing. So we work together with the laboratory services a division in terms of strengthening laboratory capacity. We work together with the counties. Where possible, we support capacity building of laboratories, especially microbiology, for ensuring that we have quality tests and accurate detection and identification. So the diagnosis component has not been left behind. They are very, very critical and integral in AMR prevention, detection, and even reporting. So we work together, and that is why we have quite a number of counties and sites that are already part of the AMR surveillance system, being part of our AMR initiatives. So this component, so this component of diagnosis, cannot be left behind.
Yeah, thank you so much, Dr. Tanui, for the elaboration. Yes, because first, as we cannot say when we are fighting AMR if we don't have the diagnostic approach with us. So we really working together. Even we have an AMR surveillance focal person who works together with the lab for the whole country at the national level. Thank you so much. I don't see any other question. I can't see a hand, or someone can help me if there is any hand. We are actually 4 minutes.
Maybe you can reshare the link for the slides for those who just recently joined in.
All right, please kindly get ready to that. I can see we are 4 minutes past the hour. No, not yet. We still have 15 minutes. So that is good. So if there is no any other question, no other comment. Okay, Alvin, go on. We have 15 more minutes. Alvin.
Good morning, everyone.
Morning.
My name is Alvin, and I have been following this presentation very keenly from all the participants and the presenters. It is such an informative forum meant to address the question of antimicrobial resistance. I just have one question to the team, particularly the pharmacists who have attended this webinar today. To what extent do we enforce policy on the use of antimicrobials in our country?
Alvin, okay, Dr. Tanui, have you gotten the question?
Yeah, I think that is more of a rhetorical question because I think as pharmacists, we are all aware about the role of ethics and professional conduct, especially in compliance with the CAP 244, which requires us to ensure that antibiotics are accessible only through the use of a prescription. So there are quite a number of antimicrobials that require a prescription for you to be able to dispense. So pharmacists play a very critical role in terms of enforcing policy on access to these medications. They play a critical role in ensuring that medicines are of good quality, so that we do not have the substandard or falsified medications accessing the supply chain, by ensuring that they procure from the approved supply chains. That ensures the integrity of medicines. Even the issue of monitoring antibiotic use and consumption. So there are very many ways in which they can be able to translate those policy into action. I think what now we require is that these regulations are actually enforced by our regulatory agencies together. I think this is where collaboration works in well between the regulators and professional associations, so that it is a two-way collaboration. We cannot rely only on the work of the regulators, because they do not have enough workforce to be able to enforce these regulations across the country. So it requires to be a collaborative effort between the professionals, the associations, and the regulators to ensure that those policies are implemented on the ground. Thank you.
Thank you, Dr. Tanui. Alvin, yes, the policies are there, the regulations are there. I think the enforcement is the issue. Thank you so much. Any other comment, any other question? I don't see any other hand. And from the chat, I cannot see any other question. So I think we are okay, we are happy. It was such an amazing webinar. And I'll just request or ask whether the community health head of division has come. Maybe she can give us a closing remark before I take it back to Dr. Tanui to close for us. Dr. Maureen, or representative of Dr. Maureen.
Actually, you'll invite the division of community health head.
Yes, that's what they're the ones I'm calling, if Dr. Maureen is around, because we missed her when you were starting. or a representative. Because as we have said community health is very key when it comes to the community in creating awareness on AMR. But if she's not in the meeting or representative, it is okay. And we thank you so much.
Shem's hand is up. Shem's hand is up.
Oh, okay, Shem. Thank you. Go on. Shem Mukadu, unmute.
Yes. I'm Shem Oino, Public Health, Nairobi County. First and foremost, I want to appreciate all the presenters for highlighting key aspects when it comes to One Health. But knowingly, let it be known that when we say about One Health, you cannot talk it conclusively without mentioning public health officers. Because public health officers, when it comes to antimicrobial surveillance, because you all agree that we have an issue when it comes to antimicrobial that are being used in food productions and environmental health space. And it is something that we need to act urgently, and it is one of the things that is the time bomb if we don't address it conclusively as healthcare providers. As being raised from the national level, it's prudent enough that all county governments, because when it comes to implementation of One Health, it is a responsibility for county governments under the health services. And if we are able to come up together and have a stakeholder engagement so that the county health services where we have the leadership, they're able to be taken through the National Action Plan. Because if we go through the National Action Plan, it provides structures, and on now we are supposed to enhance surveillance system, carry out the communication and generate the awareness from the community level. So, and even when it comes to reporting structure under the monitoring and evaluation that is properly anchored under the containment and the prevention National Action Plan, we are able to achieve it. So generally, if we are able to incorporate heavily from the national level, public health department to have a key and core representative, so that when you are doing this surveillance in our food industries, in our industrial space, and we are when we see on the animal products that are being used to our farmers, how they are being sold that don't meet the prerequisite requirements, how these products are coming from other countries, from Europe, coming through our port entry points. And remember, we have porous entry points whereby we find out that this something like pests, they are able to find themselves in our country, and they end up being used in crop production, in food, and so many things. And that's why we have so much negative impact in our health facilities. We have so many cases that are being reported, starting from non-communicable diseases. So for me, I appreciate the presenters from the national level. Is that for now, for me, my recommendation is that can we make sure that we formulate the structure as it is being done under the National Action Plan from the county level up the sub-county level. Then we come up with the focal persons. If we have those relevant departments that are supposed to carry out this AMR, generally One Health, to be incorporated in that system. So that at the end of the day, we are able to realize this journey. We are able to make sure that this country is safe from any external products that may lead us to more harm. And that's my wish. Thank you so much.
Thank you so much, Shem, for your comment. And indeed, we do take it. And I know as Dr. Tanui gives us closing remarks, maybe he can highlight on how we are doing it, because it is actually a multifaceted approach. We are working together with everyone, both at the human health. Everyone is involved. The veterinary, that is the animal health, the environment health. So we are all working together, but I'm sure I'll request Dr. Tanui as give his closing remark. He can even talk a little bit on our structure. Thank you so much. I don't think we have any other or any other comment. And mine is just to appreciate everyone for making time to join this very, very important webinar as we commemorate World Antimicrobial Week. And it's urge everyone that it is acting now, and it is urgent, and it is a collective action for us to be able to stop the AMR, which is so much threatening both today's health gains and also tomorrow's generation. So let us continue with this, and especially our audience today. This one cannot stop. We cannot AMR without community health, without health promotion officers. And we urge you kindly to continue with this, not only for this week, but let it be continuous throughout for us to be able to handle this. As Dr. Tanui told us that it is a global health threat. And if we don't act now, we'll come to have now problems with very minor infections, and with the gain that we have been having for all the years, we'll forget about it. Kindly, health promotion officers, community health officers, let's work together and let's win this. Thank you so much. Dr. Tanui, kindly, I request you to close for us.
Yes, thank you very much, Felicia. I think you've very well put it. I probably think those were even the closing remarks, the information that we all need to carry along from the knowledge and from the presentations that have been presented. I think we have a lot of things that we can be able to do and pick from those presentations. As has been mentioned, we all have a role to play in the prevention and mitigation of AMR, and we can only succeed when we work together. I think what Shem has mentioned is really the way to go. Each of us can play a very big role, and public health officers are part of our infection prevention control committees. They are part of our AMS committees. They are part of our county antimicrobial stewardship interagency committees at the county and even at the national level. So we all really need to work together. And from what Felicia has mentioned, at the national level, our interagency committees are One Health in nature. We co-develop our activities, our interventions, our priorities, and even in terms of implementation, we work together. And that is why even as we prioritize what we want to focus on during our World AMR Awareness Week, we come together from different sectors to identify the activities where we can all work together, whether we are sensitizing farmers, whether we are sensitizing environmentalists, veterinarians, and so forth. So this is really an opportunity for us. And I want to reiterate and request all of us that work, sensitization work at our areas of influence, whether it's at the facility or the community, or please continue the awareness drive, because we can only be able to achieve our intentions when we inform as many people as possible, so that we can be able to address these drivers. So mine is just to thank those who have been part of this meeting. I know it's been a long meeting, but it would not have been successful if you had not been able to attend. And we are happy that you made time to join this meeting. And even the presenters who took their time to prepare for the presentation, they are very detailed. I'm hoping that we are all able to learn one or two things here and there. So let us translate this information into action and make a difference at our points of service. Otherwise, thank you very much, and wishing you all the best as you make an impact on AMR. Thank you.
Thank you. Thank you, Dr. Tanui. I think Dr. Maureen Kemani is in, and she would like to say hi.
Good morning, everyone. I'm Dr. Maureen Kimani, Head of Community Health, and I've been following this session, and I'm very excited to see a lot of our community health assistants, our community health coordinators at sub-county and county in this webinar. And I want to really thank the AMR and patient safety team from MPHI and our health promotion team for organizing this session. I think one of the critical things is that we are building a strong workforce at the community level, which is expected to support us in managing some of our public health threats, and AMR is one of them. And so I'm really hoping that the information that has been shared here today will at least ignite some interest in all of you to start talking about AMR issues within the community during the dialogue days and other engagement forums with the communities, as well as providing updates to the community health promoters on what you've learned today, so that as they do their routine household visits, they are actually sensitizing community members, creating awareness, so that we all can fight this war together. So I'm really excited that we are part of this, and we are happy to support in any way that we expected to support. And I'm sure as you can see, the participation is heavily community. And so I really want to thank each and everyone who came for this session. And I've also learned a lot from today's session. Asante sana, Jennifer and Frank, for leading the facilitation very well. Asante, and back to you, Jennifer.
Yeah, thank you so much. Thank you so much, Dr. Maureen. Thank you for joining. We are so happy. And we are going to share the material with you, with your office, all that we have that can help the community health department to disseminate the information. Thank you so much, and we really appreciate. So thank you, everyone. Thank you for joining. We've come to the end of our webinar, and it was quite an informative, but we do not have done anything without you people. Thank you for joining in such huge numbers.
Thank you. Bye.
Bye.
Thank you. Bye. Good day.
Have a blessed day.
Thank you. Welcome.